Greetings, fellow graduates. It is an honor to welcome you to the 2024 Spring Virtual Commencement. My name is Dajane Gresham-Ryder, a recent DNP graduate from Samuel Merritt University in Sacramento, California. As I express my gratitude, I want to echo a heartfelt thank you to our ancestors, whose shoulders of steel have enabled us to stand tall despite the challenges of racism, educational principles, and most importantly, imposter syndrome. In today's nursing workforce, the common themes have been inclusivity, empowerment by taking a seat. Remember the courageous steps taken by trailblazing docs, fortified by the resilience of the melanin in our skin? As you take your seat, ask yourself, is this a safe space? Let me rephrase, is this a safe space for Brown communities? Does this space respect an ounce of who you are, like your cultural beliefs, your skin color, your smile, your work ethic, or even the innovator you were born to be? Reflect on this as you sit across from individuals who share your vision and your values of achieving equitable healthcare for all patients. When you take your seat, consider whether that chair and table possesses the backbone to support you being seen and heard. We have fought diligently to secure a place at the table. Let us not just take a seat, but strive to initiate a movement by choosing the right seat. Come on, graduates. Become the representation you have yearned for decades to come by becoming change agents and wave makers to uplift and support young healthcare professionals among us. As we move forward to choose the right seat, I am humbled by this experience and honored to introduce our esteemed visionary founder, CEO, president of DNPs of Color, Dr. Danielle McCamey.
Thank you so much for that wonderful presentation, and welcome everyone. Greetings to our board of directors, the advisory committee, honored guests, family, friends, and especially to our distinguished graduates of the class of 2024. It is my pleasure to welcome you to our 9th DNPs of Color virtual commencement. My name is Dr. Danielle McCamey, and I am the founder, CEO, and president of DNPs of Color. Before we begin, I just want to take a moment of silence for reflection and respect. It's a lot going on, y'all. And words cannot express the tremendous changes we've endured in this world. So many things have impacted our lives in such a real and profound way. So much has been required, even when we all have so much less to give. Thank you all for continuing to show up for one another and continuing to learn, teach, and work to support our mission while bearing the weight of your own life obligations and family. So please join me for a moment of silence. Thank you. Class of 2024, your talents will make room for you. This is a phrase I give to you as it was given to me by one of our fellow docs, Dr. Lolita Melhado. Here's the truth, y'all. I want you to hold on today to that phrase, your talent will make room for you, because it won't be easy. There'll be plenty of moments of doubt, rejections that sting, but that spark within you, that unique ability to create, to analyze, to connect, will be your superpower. So don't forget that. Think of it like this. The world is a giant evolving puzzle. Each of you holds your own piece shaped by your talents, your unique experiences, and most importantly, your passions. It might seem like there's no space for it, but the picture is already complete. Trust me, there's a gap waiting to be filled just by you. And here's the key. Don't be afraid to show the whole picture, because the world needs your perspective, your voice, your way of doing things. Don't try to squeeze into someone else's mold. It ain't worth it, y'all. Refine your talent. Squeeze into refine your talent, own your skills, and then own your space. And I'm going to say that again. Do not squeeze into someone else's mold. Refine your talents, hone your skills, and then own your space. The world will make room for your authenticity because you got to let them know. The world will make room for your brilliance that you bring. You don't have to journey alone, okay? Lean on the network that we have built here, the people who have challenged you, the community. Can y'all hear me? Okay. The community who has inspired you. So let me bring that back again, because I was like, I don't think y'all hearing me on today. You don't have to journey through life alone. Lean on the network that you have here within DMPs of Color, the people who have challenged you, the community who has inspired you. Find your tribe, people who will ride for you no matter what. And most importantly, the people who will celebrate you. So graduates, as you step out into the world, remember your talent will make room for you. Let your light shine bright. Don't let it be dimmed by nobody out here in these streets. Embrace the twists and the turns of your journey, but most importantly, find the joy in every single moment of it, because that will only make your light stronger and more vibrant, because the world needs you. Our community needs you to illuminate the way for others. And when you feel like your light needs to be reignited, please remember this simple little phrase: your talents will make room for you. It's an honor to be in your presence and celebrate your amazing accomplishment. Congratulations, class of 2024. May your journey be filled with endless opportunities to make a positive impact. Go forth and be great, DMPs of Color.
Good morning, everyone. Currently, the interim dean at UNLV School of Nursing, Dr. Reyes, leads the strategic vision, academic programs, and faculty development of one of the largest and most diverse nursing schools in Nevada. With over 15 years of experience as a nurse practitioner and 25 years as a nurse, she identifies as an educator and an administrator and brings a wealth of clinical and operational knowledge, skills, and insight to this role. She will be transitioning to the assistant dean for the graduate programs in the fall. Her mission is to foster a culture of excellence, innovation, and collaboration among students, faculty, and staff, and to prepare the next generation of nursing leaders who can meet the evolving healthcare needs of the community. She is dual certified as a family and pediatric nurse practitioner. She finished her DNP in 2012 for Vanderbilt University School of Nursing. Dr. Reyes is also a fellow in the American Association of Nurse Practitioners and previously served as a Medical Service Corps officer in the U.S. Navy from 2001 to 2006. Graduates, I present to you Dr. Reyes.
Good morning and congratulations to all the graduates and welcome to all the members and the guests in the audience. I'd like to start by acknowledging your accomplishments of having earned your terminal degree in nursing. I know that we all attend different institutions and we all complete clinically significant projects, but I'd like to really take the moment to congratulate all of you and also to recognize our supportive family and friends that help us when we go through our journey. I'd like to share a couple of messages that I'd like you to get from my talk today is really focusing on your professional development, being a good mentor, being a good mentee, and being true to yourself. I really like what people have said just in these last few minutes because I think it'll really resonate with what I wanted to share with you all today. My journey as a nurse started 25 years ago, and I can happily say I've been an advanced practice nurse for 16 years. During that time, I worked with migrant populations in rural Michigan, earned an MPH, joined the Navy, returned to nursing, worked in med-surg while I got my FNP, worked in pediatrics, transitioned to academia in 2012, it just feels like it's been a roller coaster. I started as an assistant professor and program director at Emory. I came to Vegas to serve in the associate dean for graduate studies role. And then in this last year, I was, named the interim dean for UNLV, and actually will have been in that role for a year in this next month. What's been interesting about the process, and something that I wanted to share, was that when I started in the position, I could not apply to the permanent position because they were looking for a nursing researcher with a PhD, specifically in the call. And I was in the position for 2 months when I ended up having a conversation with the provost, and he said, he asked why I wasn't eligible. And I told him, I have a DNP, I have a clinical doctorate, and my work is more translational and clinical in nature. And he asked a little bit more about my background, and all of a sudden these like 20 questions came at me. And before I knew it, they had actually changed the criteria and made the DNP one of the preferred degrees. I was ecstatic because being an R1 institution and being one of, a really large university here on the West Coast, I was really, really happy when I was one of the last 3 finalists with 2 DNPs in the mix and 1 PhD. So I think it's really important to claim what it is that we bring to the table. I never lose an opportunity to share that, we don't do this in medicine and dental. They don't have this requirement to have a PhD. They're clinical in nature. And so I think it's going to be, really important for nursing to recognize that changes are needed in the country and that we as DNPs bring a lot to the table. Many schools are struggling to find good people. These roles are not easy. They involve a lot of strategic thinking, vision, resource management, external relations, guiding the research, all while keeping to our core mission of educating future students. And I learned, very quickly to get over imposter syndrome and take my seat at the table. Even though I wasn't tenure track, I never felt that my role was diminished. And I really did, though, have to spend the time educating people on what a DNP meant and what the strengths were that I brought to this position. In regards to taking your seat at the table, I was one of 5 health science deans, and I will admit I never could let my guard down. Whether in discussions about clinical placements or attending state legislative meetings, I made sure nursing was key to all discussions. In this last year within my leadership role, something that I learned about my own personal leadership style is that it was very different from when I started in the Navy. I was in a male-dominated finance world, and having come into this position in a nursing school, let me just tell you, it's very different. We did a real colors assessment here within the school to learn about our communication styles. And what I learned is that 60% of my faculty and staff were considered blues. If you've never done real colors, it means that they are feelers. And that was actually my lowest color. So I've had to adjust my communication style to really, work well with everyone here within the school. Something as simple as asking how you're doing really can make a huge difference when approaching people that are different in terms of your communication style. When I look back at my career path, as you're all finishing your DNP, really, do what feels right for you. I was having a conversation with Danielle actually a few weeks ago, and we were talking about, sometimes it's hard to say, like, what is my picture? Like, what's my, body of work? And you'll hear people say, you really need to focus and have this clear path. And it wasn't until recently that I identified social determinants of health didn't really exist as a concept when I started in nursing so long ago. So my journey has actually been on a more linear track than I actually realized. But I do have to use my cover letters to kind of paint that picture because my CV, doesn't always necessarily follow that. I'm super interested in policy and continue that work. I did a 2-year stint as a co-chair for health policy with the National Association of Hispanic Nurses. And again, just very exciting work and lots to be done in today's world. And so when people ask, like, why did I choose the DNP? I completed an honors thesis back in undergrad. As a nurse practitioner, I did 2 studies, but what I found is that even though I was doing these studies, it was what I was learning with the results and how it was really addressing the needs of my patients and changing the way that I practiced, that I realized the DNP was really a better fit. When I transitioned into academia, for those of you wanting to go this way, it's really important to understand the currency of academia. You need to have your scholarship. and be a good mentee. I will be forever grateful for my first mentor match. I was clinical track assistant professor. My mentor was a full tenured, very accomplished researcher who was the editor of Research in Nursing and Health. And let me just tell you, when she got a hold of my DMP project, she told me she'd help me get it published. I got it back. The whole thing was red. This is back before, track changes in Word. It was red ink. It was red. I went through 3 editing rounds with her. I found it fascinating. But the biggest thing is she always thanked me for being such a good mentee. She would say, "You seem to really appreciate my feedback." And I'm thinking, well, you're an editor of a journal. Like, how am I not going to take these suggestions? And I got my first my first publication of my DMP project accepted with no revisions on the first round. So very exciting. My teaching mentor, same thing, was very open to feedback. And so all of that to say, again, health disparities is at the heart of what I do. It's always, I think, very exciting to, work with our populations, work with our students, work within the community. I love what DMPs of Color has done in the last couple of years. I remember when I first saw it, and it really resonated with me. Like when I went through my master's program, when I went through my DMP program, I was one of one, and to be able to find a community where I feel like I'm able to thrive, I think has been just fascinating. I now work in student health along with, soon to be going back to my associate dean role. But what I find fascinating is that I work with college students. And so my thesis back in undergrad was about people's kind of attitudes towards sex education and their own personal care. And, I work with the student health population here on campus with college students. And I get so frustrated because, it's been 25 years since I did that thesis, and it feels like not a lot has moved in that area. So I love the translational piece of taking the knowledge of research, applying it to the care of my patients. And I feel like, even though I've may have not had the most straight path, it's been a perfect way of kind of melding it all together. Hopefully, with all of this, I painted a picture of what you can do with your DMP, also understanding the power that you bring with it, and never forgetting that it's going to take time. And, even though we've been around for a while, people just don't understand exactly what it is that we do. And so hopefully as time goes on, that'll be more solidified. But I do want to highlight the importance of mentorship. Be a good mentor, be a good mentee, focus on your professional development, have those goals set for yourself, and don't forget to bring those behind you along as well. So I just like to say thank you, congratulations, and cheers.
You're on mute.
We can't hear you. You on mute.
You would think since 2020, we rocking on Zoom that we won't be on mute all the time, but here we are. But wanted to say thank you so much, Dr. Reyes, for an inspiring message, and really appreciate you joining us today, because you've been riding with DMPs of Color since day one as one of our founding advisory board members. And now to see you as interim dean at UNLV is truly inspiring. So thank you for being the blueprint of what's possible for us as DMP prepared nurses.
Thank you.
All right, y'all ready to celebrate some graduates? Let's go. So I introduce Dr. Yvette Rose, who will begin our presentation of our graduates.
Yeah, cool.
We can't hear you, Dr. Rose. I'm not sure if your sound is working. No. All right, we'll call in Dr. Brenner Hill to.
Dr. Rashawn Ballard, Coppin State University, an exploration motivators for primary care setting, behaviors in adult African-American males, 18 years of age and older, a grounded theory study. Dr. Natasha Baptiste, Malloy University, overlooked, underdiagnosed, and undertreated, improving healthcare providers' knowledge and confidence on cardiac amyloid screening. Dr. Sophomore Beasley, University of South Alabama, increasing COVID-19 vaccination rates quality improvement project. Dr. Tiffany Biddle, University of Virginia, evaluating racial disparities in a NICU prenatal support bundle. Dr. Othini Blessing, Chapman University, the impact of a mentorship program on nursing clinical ladder program participant intent to complete. Dr. Jacomara Bowman, Chamberlain University, impact of the Mediterranean diet on depression in women. Dr. Idris Clark, Frontier Nursing University, implementing effective care for patients at risk of lung cancer at an outpatient clinic. Dr. Anissa Coates, Robert Morris University, examining the impact of organizational support on the secondary traumatic stress of mental health professionals exposed to workplace violence. Dr. Angela Cooper, Coppin State University, the development and implementation of a hypertensive self-care web-based resource. Dr. Clarice Monique Crenshaw, Monmouth University, development and evaluation of a toolkit for registered nurses on the psychosocial issues of patients with atrial fibrillation. Dr. Belinda Dawkins Francis, Walden University, education to dialysis clinical staff about the role of advanced practice registered nurses in home dialysis. Dr. Jill Day, Yale University, my identity, improving mental health outcomes through group support in pre-treatment transgender teens. Dr. Joanna Dennis, Thomas Edison State University, prevention of medical device-related pressure injury in the pediatric intensive care unit, utilizing the Braden QD scale and QR code technology. Dr. Asia Ibe, Rush University, evaluation of development care in the level 3 NICU. Dr. Natasha Jennifer Ferry, Duke University, implementing an adverse childhood experiences screening tool with migrant children, a quality improvement project using the PEARLS screening tools. Dr. Wendy Garvin Mayo, Quinnipiac University, implementation of hypertensive guidelines in a primary care setting. Dr. Serena Gaba, Johns Hopkins University, increasing diabetes self-management referrals and participation in primary care clinics. Dr. Sharita Gibson, Coppin State University, a mixed method exploration of non-adherence in hemodialysis in African-American men 18 and over, a pilot study. Dr. Dejanay Grishon Ryder, Samuel Merritt University, promoting civility and sense of belonging among nurse leaders. Dr. Diana Hampton, Grand Canyon University, DNP. Dr. Shantae Harris, Post University, Leadership development, the impact of a virtual leadership webinar on nursing leaders' leadership practice inventory scores. Dr. Michelle Lynn Johnson, Capital University. Evaluation use of intentional rounding for fall prevention in a skilled nursing facility. Dr. Patrice Kingsley.
Dr. Jerome Johnson, Azusa Pacific University, Diabetic Foot Care Education for Wound Care Providers. Dr. Erica Johnson Lockett, East Tennessee State University, Improving Patient Care in Rural EDs, Streamlining Diagnostic Tests. Dr. Jennifer Joyner, University of Texas at Austin, Cost Predictors for the Care of Late Preterm Infants, a National Perspective. Dr. Anita Larkin, University of Tennessee Health Science Center, Implementation of the Mindfulness-Based Stress Reduction Program to decrease the severity of anxiety. Dr. Cassandra Millian, St. Thomas University, Improving HIV/STI Screening for older adults in a primary care setting. Dr. Cynthia Moody, Aspen University, does the implementation of adding a Braden scale to the admission assessment in a correctional setting increase the number of wounds identified on admission? Dr. Tanya Morris, Chamberlain University, Empowering Communities, Adolescent Obesity Intervention through Nutrition, Exercise, and Screen Time, an Integrative Review. Dr. Ted Morris, Vanderbilt University, Enhancing Medication-Assisted Treatment Utilization in Combat Opiate Use Disorder, to combat opiate use disorder. Dr. Miriam Oluyinka, Seattle University, Enhancing Equitable Care in Mental Health by Educating Staff on Providing Cultural Humanity Care, an Improvement Study in a Community Mental Health Setting. Dr. Uchechi Onyegirim, Wilkes University, Quality Improvement Project on Universal Anxiety Screening for Adults in Primary Care. Dr. Concepcion Pachequiano, Aspen University, Transitioning to Adult Care Using the Transition Readiness Assessment Questionnaire, TRAC. Dr. Dominique Pearson, Michigan State University, Improving Angioedema Crisis Airway Management by utilizing high-fidelity stimulation training and 3D larynx models, a quality improvement project. Dr. Sheila Pierre-Louis, University of Maryland, Moving to the Bedside, Standardizing Bedside Shift Report. Dr. Dawnette Price, Thomas Edison State University, Decreasing Work Task-Related Pain, a Quality Improvement Project. Dr. Sylvia Rainey, Massachusetts General Hospital Institute of Health Professions, Workplace Violence in the Ambulatory Setting, a Quality Improvement Project. Dr. Minnie Raghu, University of Maryland, Assessing Patient Portal Utilization after implementation of portal enrollment on hospital admission. Dr. Cheryl Robinson, Capella University, Raising the Quality Meter, Tackling Hospital-Acquired Pressure Injuries in the ICU. Dr. Willa Smiley, Aspen University, Epidemiology, Implementing the Cannabis Use Identification Test Revised for Best Practices. Dr. Tiffany Sumter, Coppin State University, the implementation of a comprehensive video monitoring approach to prevent falls in long-term care, a pilot study to improve practice. Dr. Keisha Williams, Virginia Commonwealth University, identifying inpatient fall risks at the Virginia Treatment Center for Children using a fall risk assessment validated for pediatric behavioral health.
Dr. Yin-Hee Wan, Johns Hopkins University, Effects of an Educational Intervention on Provider Attitude and Knowledge with Buprenorphine. Next, Dr. Dwayne.
Hello, everyone. Sorry. I'm Dr. Dwayne Lean, the board chair. And as board chair, I'm filled with immense pride and admiration for each of you, the graduates of your DNP program. Today, we got a chance not to only celebrate the culmination of your rigorous academic journey, but also the beginning of your impactful careers as leaders in healthcare. So your dedication, your resilience, your unwavering commitment to excellence have brought you to this significant milestone. So throughout your journey, you have not only advanced your knowledge and skills, but also paved the way for future generations of nurses of color. Your presence in this nursing field is vital, and your contributions are invaluable. You stand as beacons of hope and inspiration in a world that urgently needs your voices, your compassion, and your expertise. So as you move forward, remember the power you hold to influence and transform healthcare for the better. Your unique perspectives and experiences are essential to creating a more inclusive, equitable, and just healthcare system. So I urge you to continue to push boundaries, challenge the norms, and advocate for those who need it the most. Your journey does not end here. It's merely the beginning of a lifelong mission to make a difference. So embrace this role with the same fervor and determination that brought you to this point. So congratulations again to all the graduates. We are incredibly proud of you and excited to witness your impact, and you will undoubtedly make it in the world. So go forth with confidence, courage, and the knowledge that you are making history. So thank you, and may your future be as bright and promising as you dreamed it to be. So let's give a congratulations to all the new DNP graduates. So also the Morris family likes to personally congratulate all the DNP graduates of 2024.
Latrina Walden Exam Solutions, proud to be in partnership with the DNPs of color. Our comprehensive suite of products is designed to help you pass the FNP, AGNP, Acutes, and PMHNP board exam. Introducing the Academy, your all-in-one resource for AANP, ANCC, Acute, and PMHNP exam prep, featuring 400+ PowerPoints, body system PDFs, transcripts, and more to help you pass your board exam. Master essential skills fast with our clinical crash course, perfect for those with limited study time. Join live review webinars for real-time insights and guidance tailored for rapid comprehension. Explore our range of study aids, from flashcards, quizzes, practice exams, to many more. Visit LatrinaWaldenExamSolutions.com, your partner in success. Use code DocLife2024 for 15% off and email us at info@LatrinaWaldenExamSolutions.com to get your free book. Unlock your success today.
And remember to join DNPs of Color. Membership is still available. Just scan the QR code. We have different payment options for you. So if you haven't joined it or have a friend that needs to join it, you don't have to be a DNP to join. Spread the word. We would love to have you. And just remember, save the date for those that may be graduating in December or between now and December. We will be doing this again in December. We usually do every December and June. So spread the word as well. And remember, our conference is coming up real soon. Next thing I knew, you was all up on me screaming.
She's all up in my head now. Got me thinking that it might be a good idea to take her with me. She's ready to leave.
What happened to the music?
We getting serious for the picture right now. We
All
getting
right.
serious for the picture. We'll go back to the party in a moment. So, but big hand clap. Come off mute. Y'all was like the most quietest virtual graduation. Normally, folks unmute
I'm
themselves
off
when they see
mute.
themselves, but now's the time just to bring out the joy, the excitement,
Woo!
hand claps, the woo.
Yeah, let's make some noise. Make some noise. Y'all got something to celebrate?
The building.
Congratulations to all.
Congrats. Y'all
Congratulations,
did
everyone.
it. Y'all did it.
All right. So
Guys,
we
we're
are
awesome. Bye.
Yes, bye.
Y'all
So
were
we are going
awesome.
to
Bye-bye.
do a group photo. We have a couple of screens, so please come off of your silent cameras, turn on your cameras, and on the count of three, like I said, we have three different panels, so keep your cameras on. Count of three, 1, 2.
Yeah, it's not a video, but I just want, they said they were live on
We can hear
YouTube.
you.
Okay,
We
wait
can
a
hear
minute.
you, Dr. Smiley. You loud, boo. All right. So on the count of three, turn your cameras on. 1, 2, 3. All right. Last panel. Keep your cameras on. Keep your cameras on. All right. 1, 2, and 3. Cheese. Hey. Cool. Latrina. All right, well, that is all we have for you all this morning. It's always a pleasure and honor to celebrate and hold space for you all. There's no celebration like our celebration with DMPs of color. So like Dr. Aline said, please join us in December in support of your colleagues that are graduating in December. I'm a December graduate, so I always hold space for those folks graduating in December. And please tell everyone about DMPs of color. We welcome everybody. There's lots of seats at our table, and there's lots of work out here for everybody. So if our mission resonates with you, we would love for you to join us in advancing doctoral nursing practice, changing the game, and forging new paths. So please share with your networks that your experience here, and we look forward to seeing you all in December. Have a great week and be great.